Welcome, everyone, to another episode of Family Engagement Broadcast with HES Academies. And I have in our studio again our guest speaker today, Miss Hala Mala. Hello, Hala.
Hello everyone.
Hala is a health educator with Access, and she has participated continuously with providing programs for our community. Thank you again, Hala, and thank you, Access, for all the programs that you provide for the community. Uh, Today, Hala will be speaking about what you need to know about drugs, and I think she's also going to speak in general about addiction. Before that, I just have a few announcements. As you have heard today from our district, our charter district at GS Academies, we are extending the virtual learning for another week from January 10 to January 14 due to the high rate of positive rates of COVID-19. Hopefully, we're giving everyone enough time for quarantining, and by next week, we will get back on Tuesday because Monday is Martin Luther King's day, and that's going to be an off day. And then we'll be back in school learning on Tuesday, January 18, 2022. If you have any questions about that, please feel free to reach out to your school. Please make sure that you are ready, dear students who are hearing us right now, and parents. Make sure that students are ready in the morning on their computers to attend their live sessions. Without further ado, Hala, you can take it from there, talking about what we need to know about drugs. Thank you.
Thank you. Hello everyone, and today I will be talking about all the information that you need to know about drugs. And what you can expect from our conversation today is to learn about some of the effects of drugs on the mind, on the body, and then we will spend most of the time looking at an overview of some of the common drugs that are used and misused, and then some of their effects that they can have on people. And then we'll end the conversation by having an understanding of why some teenagers use drugs, why some stay away from drugs, and then also, of course, leaving you with some resources for your teenagers, and then also how you can help your child in preventing drug use. So before we can talk about all that, we should have an understanding of what drugs are. And drugs are chemicals that change the way a person's body works. So they're going to have some sort of change that is being made to the mind, to the body. And then this picture over here is just showing a general way that drugs can alter or change the person's body. And again, there are different drugs. They're going to have different effects on different people. But in general, they can impact the brain. They can cause some sort of changes in the nervous system. And then they could also interfere with learning, with memory, especially short-term memory, a person's ability to focus their attention, their ability to maybe walk, their coordination, anything like that can be altered by drugs. And then also respiratory system, the lungs, liver, the kidney function could be changed or altered as a result of drug use. And then that could also lead to a difference in the way these organs are functioning. And then also a person's vision, a person's motor skills can be impacted by drugs. And then also with some drugs, there are cardiovascular risks. So again, there's going to be a different effect on each person, as well as depending on the drug that is being used or if it's being misused as well. But in general, these are some of the changes that can happen with a person. And then with drug use, there's also addiction, especially if there's drug misuse going on, there is that risk of a person becoming addicted. And addiction, in terms of any kind of drug use, would be when that person has that compulsive need to seek out a drug, despite the harm that they may cause. So a person a lot of the time is aware of some of the harms, the risks, the changes that drugs can be causing them, but they have that need to seek out that drug. And a lot of the time, a person is also aware of maybe the way drug use can harm relationships or any kind of factors in their life, but they still are addicted and they have that need to seek out that drug. And also with addiction, that could also be because a person might be experiencing withdrawal symptoms. That can occur with drug use, with addiction. And again, different drugs may have different withdrawal symptoms on a person. Each person, again, is different. But in general, withdrawal symptoms are going to be the physical and then the psychological effects that can happen to a person if they reduce using a certain drug or if they stop using a certain drug. And then also with addiction, a person may have that strong urge to seek out drugs because they are either going to try to avoid the pain that is coming with a withdrawal symptom. They try to avoid the withdrawal because that's going to be an unpleasant thing for them to go through. So they seek out those drugs to either stop the withdrawal from happening or to prevent it from happening. And that's really what can also draw the person's drug use behavior. And then drugs can have different effects on the brain and the body, as I had given a short overview about that earlier. And then this goes into just a bit more detail. And this can help you get an understanding of how the brain is impacted when a person uses or misuses drugs. And mainly, drugs can alter the important areas in the brain that are responsible for sustaining our life, for our breathing, for our blood flow, and anything like that. And then the main brain areas that are affected by drug use, drug misuse, can include the brain stem. And this is what connects the brain to the nervous system, so that can be affected and altered as a result of drug use. The prefrontal cortex can also be impacted, and that's responsible for our thinking, our reasoning. And then also the limbic system, which is responsible for our feelings, for our emotions, can also be impacted by drug use. And this can also change the way these different systems function. And with the brain, drug use can also affect the reward system. And this here is one of the strong motivating factors for a person to seek out drugs and what also can drive addiction. And the way the drugs are going to be affecting the person's brain is by tapping into the communication system of the brain. And this is when the drugs are going to then interfere with the way the neurons in the brain normally send, receive, process information about the world around us. And most of the drugs that are used, misused, then alter or target the brain's reward system by flooding it with large amounts of dopamine. And that's that feel good chemical. And so that is really what starts to be that powerful, rewarding motivator for a person to then seek that drug again and again. because that good feeling that a person experiences is a really strong motivator. And the person wants to take part in that same behavior just to try and get that rewarding feeling. And then this picture over here is showing some of the ways that the brain's pleasure center is targeted by drug use. And all drugs that are misused increase dopamine to some extent. And we have natural dopamine responses. These occur to natural rewards such as food. When a drug is taken or misused, dopamine is then increased but at an exaggerated rate. So it's a lot stronger, a lot higher amount of dopamine than is what is naturally available to us or naturally occurring. And then that's when that communication system then is altered. So there's that change happening there. And then the key to remember is this is one of the main driving forces behind a person's addiction with drug use. And then this further shows how the brain's reward system is altered from drug use. And this then leads the person's reward system to become abnormally low. So that natural dopamine level, the dopamine system that we naturally have, is going to become lower. So, for example, let's say a person's dopamine levels were right about here at that natural level. When a drug is taken, is misused, the brain is again then flooded with dopamine. So that's about up to here. And then once the effects wear down, it's back to that normal level. When that happens over and over again, that natural dopamine level goes from being right here to much lower than it was before as a result of the drug use. And that communication system's altered, so it's at a lot lower level. So then a person has to take more and more drugs just to try and get to that once, baseline normal level that they were at before, let alone take even more drugs or different types of drugs to get to that higher dopamine high that they had once sought after. And when this happens, it's what we call tolerance, a drug tolerance. And the person may then need to take larger amounts of a drug or maybe mix drugs together. Anything that can try and increase that dopamine reward level that was once there in the beginning. So you have now a general understanding of what are the driving forces, some of them, behind drug use, how addiction can happen, withdrawal, and then again, the changes that can occur to the mind and body as a result of drug use. That's a more general understanding of that before we get into the main information for today and looking at the different types of drugs and how each one can affect each person. Again, different effects for different people. But in general, just some of the different effects that these drugs can have, how they're used, or different ways that they can be used. So we're going to discuss everything from nicotine, alcohol, marijuana, all the way to cocaine, hallucinogens, steroids, K2 or spice, and so on. So starting off with nicotine, and nicotine is that addictive stimulant that is found in cigarettes and in other forms of tobacco. And stimulants get the person's body moving quicker, increase in energy, increase in focus for that time that it is being used. So a person is going to be moving a lot quicker once they do use a stimulant. And then some of the different forms of tobacco, and then tobacco has nicotine that is found in it. And different forms would be hookah smoking, cigarette smoking, there's chewing tobacco, cigars, and pipes as shown here. And when a person is smoking tobacco, there is that increased risk of cancers, emphysema, bronchial disorders, and then cardiovascular disease. These are all some of the risks that can happen as a result of smoking tobacco. And then also with nicotine, and this is a different form of smoking tobacco, and this is a vape. And vaping is the newer form of tobacco use. And with this device here, usually there's an e-liquid that is being heated up and then inhaled. And the e-liquids are made up of a mix of chemicals. These would include nicotine. There could also be formaldehyde. It could be a lot of different, cleaning chemicals, different chemicals just found in that e-liquid. And many assume that it's just water vapor when it's not actually just water vapor. There's a lot more chemicals that are found there. And actually, a lot of the chemicals that are found in tobacco and traditional cigarettes can be found in the e-liquids that are smoked using a vape. And then some of the risks that can be found with vaping tobacco, that could be nicotine addiction, similar to other tobacco products, but also it could lead to gum and mouth problems, any kind of lung irritation. There could be that risk of breathing problems and a weakened immune system. And especially now when you really need your immune system to be strong from the virus and everything like that, there is really a large risk that can come with weakening the immune system as a result of vaping. And there is still very little that is known about the long-term effects of vaping. It's relatively new, and there are new discoveries that are being found every day. And so there is still a lot that is unknown about some of the long-term harms that can come with vaping. Taking a look at the next drug, and that is marijuana. And marijuana is a mixture of dried flowers from the cannabis sativa plant. And marijuana contains what is called cannabinoids, and these are the naturally occurring chemical compounds that are found in marijuana. And then there are more than 100 of these chemicals in cannabis, but the main ones that we will look at and the main ones that are usually looked at would be THC and CBD. And these can cause drug-like reactions in the body. So they're going to alter some sort of function in the body or alter the way the body is working to some extent. So with THC, that is the main mind-altering chemical in marijuana that people usually seek. It's responsible for that intoxicating effect that people seek when looking or when thinking about marijuana. It's usually the THC that they are seeking. And this is found in the resin that is produced by the leaves and the buds of the female cannabis plant. And that is different from CBD. And CBD doesn't contain any THC. It doesn't produce that intoxicating effect, that intoxicating high that many people seek. And so that's the main difference to keep in mind. And then many people have claimed that CBD, when they use CBD, it helps them with anxiety, insomnia, or chronic pain. But there is still currently little evidence that proves that CBD can help with these. And then this picture here, or these pictures here, are showing some of the different forms that marijuana can be used in, different ways that it can be smoked or ingested. And then looking over here, the first way would be through what is called a blunt. And this is when typically a cigar that traditionally has tobacco inside of it is hollowed out, and then the marijuana is replacing it. Or it could be a mixture of tobacco and marijuana inside of it, and then that is smoked. And similarly to that is a joint, and that contains marijuana. It's usually rolled in a cigarette or a tobacco wrapping paper or rolling paper, and then it is smoked as well. There's also a vape, so that is similar to when a tobacco product is being vaped. The e-liquid, instead of it being tobacco, would be the oil, so a marijuana in the form of an oil, in the form of a liquid, and then it is smoked similarly to a electronic cigarette. And then similar to the vape also is something called dabbing, but the difference here, instead of it being a liquid or an oil kind of form, there's butane that is poured over the marijuana leaf, and then it creates what you can see over here, this kind of solid-like substance. And then that is smoked using this device over here. So when the butane is poured over the marijuana leaf, then that THC that's there leaves or escapes that leaf, and then it is found in this substance that is created over here, so in that wax-like substance. And then other forms or other ways that marijuana is smoked is also through using a bong. And this is a diagram here to show the different parts and components of it. And it can be sort of related to a hookah. So the way the hookah is used is just going to be that different substance. And typically there's water involved and smoke and everything like that. But then also marijuana, rather than just smoking it, can also be ingested, whether a person eats it or drinks it. And some turn it into a tea, or they mix that marijuana oil with other kinds of drinks. And then it can also be used in baking or can be found inside candies. And then the danger that comes with ingesting marijuana in the form of a drink or food is that a person doesn't really or isn't aware of the dosage that they are taking in. It could be a much higher dosage than they're aware of. There's that high risk and high chance of someone then overdosing on that. And then also with eating marijuana, there could be that delayed response. So if a person is smoking the marijuana, they could have an immediate sort of feeling in their body, and they can have effects that happen rather quickly. But with eating the marijuana products, there could be a delayed reaction in the body. So a person may then feel that the product didn't really take an effect as it should, and then they might take a larger amount. So maybe eating a lot more of the candies or the baked goods. And then that also creates that risk or chance of an overdose happening without a person really meaning to or being aware of it. And then so looking at some of the next drugs, and this one is alcohol. And alcohol consumption has certain dangers, and it can damage the body in a certain way. Specifically here, we look at the brain, most of the body organs such as the heart, the liver, the pancreas. So alcohol can cause damage to those parts of the body. It can also have increased risks that come along with it. So it could increase the risk of some cancers. It can weaken the immune system. It could also put the fetus development at risk. So anyone who's pregnant and drinks alcohol, it could put that fetus at developmental risks. And then also it could lead to some deadly accidents. This one is an example of vehicle accidents, but it can also play the role in many different accidents as well. And here we have listed a few statistics that shows some of the different risks that alcohol can cause or the role it plays in certain deaths. And about 1,580 deaths can occur from car crashes where alcohol has played a role, and specifically looking at young people. So anyone who's under the age of 21 and is drinking alcohol, these are some of the risks that are associated with it. It can also play a role in accidents like alcohol poisoning, falls, burns, drowning, where alcohol has played a role. It's also involved in crimes, murders, and then also used along with suicides. And so there are many risks that come along with alcohol. And then moving over to looking at some of the prescription drugs. And prescription drugs or prescription medications can also be misused, and they are being misused at an increasingly growing rate. And when prescription drugs are misused, that means they're being used in ways other than what is intended, or they may be being used without a prescription, or they're being mixed with other kinds of drugs. And when it comes to prescription drugs, many have this false idea that they cannot be harmful, that they can't be dangerous because they've been prescribed by a physician, that they have a prescription for it. But that's not the case. They can still be harmful, especially when they are being misused or used, for someone who they don't belong to. And then with prescription drugs, there are also different kinds. There could be opioid painkillers. These are usually prescribed for a person to relieve pain, usually after a surgery or something like that. Also, there are stimulants. So these are commonly prescribed for things like ADHD. And then there are also depressants, either to help promote sleep or to reduce anxiety. And then the final one would be something referred to as lean or purple drink. And this describes soda that is mixed with prescription strength cough syrups. And these prescription strength cough syrups contain codeine, and they're only available by prescription. So you can see that these have very high strength. And when it is mixed with some sort of soft drink, when it's mixed with juice, a person again isn't going to be aware of the dosage, how much is in there, and that can increase that risk of taking a lot more than the body can handle and then overdosing through that. And then with prescription drug use, there's also misuse. And it's important to understand the difference. So not all prescription drug use is immediately going to be something that's alarming or dangerous or harmful. And usually with drug use or prescription drug use, it's when it's being prescribed to a person by a doctor, it's taken in the correct dose. When it's used with the purpose of treating something, treating some medical condition, and also, it has been carefully screened for any kind of interactions, again, by a professional, by a physician. But then that turns to trying to understand what misuse would then be. And this is when it's being provided to a person by a friend, a family member, a stranger. It doesn't really belong to the person, or maybe the person didn't receive a prescription for it. So the dosage, the issue there is the dosage could be stronger. You don't know if that person could have an allergy to that medicine, especially because they haven't consulted a doctor and they don't know if it's something that's safe for them to use. And just because it's safe for one person doesn't mean it will be safe for another. And then also with misuse, that includes when more than the proper dose is taken, more than the prescribed dose is taken. So even if a person has a prescription for it, they're using more than what is being prescribed for them. And then also sometimes people might feel they need a certain prescription drug. They feel bored, they try to self-medicate, they're using it to relax, for fun. And those are also when the drugs are being used for the wrong reasons, with the wrong intentions. And then also when prescription drugs are combined with other prescriptions, with other street drugs, with alcohol, anything like that. So looking for how they're being used, do they belong to the person, or are they being mixed with anything else, or being used for the wrong reasons? And part of the prescription drugs, then there are opioids, and some of their effects when being misused could be the chance of a person experiencing serious breathing problems, things that could lead to death. It could also lead to addiction, nausea, confusion, sleepiness. And then there is that increased risk when they are mixed with other drugs, whether they are prescription drugs or street drugs or alcohol. And then looking at a few more common types of drugs that you may hear about or may see, there are hallucinogens, and these alter a person's perception. They are also very unreliable, and their effects are not consistent. So we can't really say that this hallucinogen will have this exact effect on this person and it'll have this exact effect on another person. Each person is going to have a different reaction to them, but also each of these drugs themselves can have a different effect on a person at different times. So it's not really something that's consistent. And that has a lot of risks with it too, because a person may take a hallucinogen today and have a certain reaction, but if they take another one tomorrow, that could be an even more severe reaction to it. So they don't really know what to expect each time they are taking them. Heroin is another common type of drug, and this is a powerful opioid drug. It usually produces euphoria, feelings of relaxation for the user, and it can also slow respiration, can maybe increase that risk of serious infectious diseases, especially if they are being used with needles, whether a needle is being reused or if the needles are being shared among other people. So that can also have infectious risks with it as well. And then there's also cocaine, and this can lead to severe consequences, especially with the heart and the respiratory, nervous, digestive systems. And with cocaine, a person who uses that can also experience severe paranoia. They could lose touch with reality. So, those are some of the general effects that a person could experience from using these types of drugs. Along with that, there's also MDMA, sometimes referred to as ecstasy or Molly, and this is a man-made drug that alters mood, it alters perception, so a person's awareness of their surroundings, of the conditions around them, and usually produces these feelings of increased energy. A person may experience increased levels of emotional warmth, pleasure, distorted sensory and time perception. And then it can also cause sweating, chills, nausea, blurred vision, among many other effects. And then there are also inhalants, and these are substances that can be found in many household products. And these could include oven cleaners, gasoline, spray paints, a lot of other aerosols as well. And these induce mind altering effects. And they're extremely toxic. They can damage the heart, they can damage kidneys, lungs, and the brain. And sometimes even after the first use of these. So a person could try this one time and then suffer these very life threatening and dangerous consequences as a result. There's also K2 or spice, and this refers to the variety of herbal mixtures that are sprayed with man made chemicals. Some of the side effects of K2 would be paranoia, anxiety, and then hallucinations as well. So, this is a synthetic or man made drug. So, then we look at why do teenagers use drugs? And some of the reasons why teenagers may turn to drugs would be because of stress. Some may think it's cool. Some may use it to self medicate. Sometimes a family member or a friend uses drugs, so a person or a teenager might see that and follow along with that kind of behavior. Also, they may not know the dangers and risks of using drugs. So sometimes teenagers don't know about the harms, the dangers that would come with taking part in this behavior. And I'm sure you can also take that time to think of some other reasons why a teenager may turn to drugs. So again, is that peer pressure? Is it trying to self-medicate? Or is it something else that we may not be aware of? But then there are also teenagers who stay away from drugs, and to explore some of the reasons for that. So many teenagers know and understand the risks and the dangers that are associated with drugs. Many do not want to harm their bodies, their brains, their mind. And then also many keep themselves busy by taking part in sports, dance, other healthy behaviors and activities. And then maybe some teenagers have witnessed a loved one pass away from drugs, or they've seen the damaging effects that it can have on people that they're close to and people that they know. And it's important to understand those two aspects of this. Why do some teenagers turn to drugs? And then why do some teenagers stay away from drugs? And so that can kind of guide the way you can help a teenager, either in preventing them from using drugs to begin with, or if they may be experiencing problems with drugs, how you can help them as well. And keeping those reasons in mind. So, one of the first ways in preventing drug use with your child, with your teenager, is to let them know that you want to have a conversation about drug use, about drinking. So, you do want to have that conversation with them and making it clear that you're about to have that conversation with them. Also, to set rules and to be clear about those rules, be specific about what will happen if they do break them. So you can set out your rules for preventing drug use, no tolerance for drug use, and then being clear what will happen if they don't listen to those rules. And that's a key thing here, because if your child is maybe pressured, peer pressure, they might see sort of this behavior in school with their peers, it'll make it easier for them to say no. They'll feel more comfortable with it. And these clear rules will make it easier for them to say no. Also, if you want to help your child understand why drinking or drug use is dangerous, you can also show them how these poor choices can impact their life. So, trying to have that conversation with them and setting that scene for them to be more receptive to the information that is being shared with them. But with that, you want to make sure you're being honest and you're being reasonable. You don't want to show fear tactics, you don't want to over exaggerate when having this conversation. And you also want to avoid stigmatizing or kind of being harsh or judging them in that aspect, because you don't want them to shut away and you do want them on your side with that. And if fear tactics are used, usually a teenager will shut down or you'll lose their interest. They'll kind of play this as being something that can never happen to them. And it kind of, misses the point that you're trying to make. But you also want to resist that urge to lecture. You want to give them a chance to express their concerns, their feelings, and also maybe they've been hoping to have this chance to ask you questions, or maybe they wanted someone to check in on them and something may have been troubling them. So they may have been waiting to have this conversation, and this is finally that moment for it. And then if there are adolescents, teenagers who are using substances regularly, it is recommended that you have an assessment done for them by a professional who can support them in that behavior change. And here are some resources that you can now take away from this presentation that you can look at and use to apply either to help preventing or help prevent drug use, maybe help a child or teenager who is struggling with drug use, and they can also be accessed right after this presentation. So thank you for listening and open for any questions now.
Thank you, Hala, again for a beautiful presentation, important presentation, really, a comprehensive one with very important slides. We will also make this available immediately after the session is over, so parents can share it, they can return to it to check out resources on it. They can, pause it if they want to copy a link or reread some information. With that, we have no questions. This is another reminder that for the dear parents community that's listening to us right now, if you have your kids, go to HES Academies. This is a kind reminder that we will be virtual next week from January 10 to January 14. And then January 17 is an off day. And then we're going to be back in person on January 18, Tuesday, 2022. For more information on lunch pickups, they will be available on all the Academy's social media. If you have any questions, please do feel free to send us your questions through. If not now, if you listen to this later, you can always leave comments or you can email us or let us know. We'll always direct the questions to the right people and get you the right help. We can always connect you to Hala, who works in Access. It's very easy to get hold of Access if you need any help. Any final words, Hala, before we depart?
Thank you so much for having me as always, and it's a pleasure to be able to share this useful information with everyone.
Thank you. Thank you, everyone, and we'll see you in the next Family Engagement broadcast.
HES Academies have been serving the Detroit metro area for over 23 years, promoting academic excellence, leadership, and cultural diversity, ranking as some of the top schools in the state of Michigan. Our pre-K through 12th grade students enjoy tuition-free, state-accredited education by STEM certified and highly qualified staff with no geographical restrictions, and with advanced placement, college dual enrollment, scholarship, and Arabic language programs. Nor International Academy in Sterling Heights at niapsa.org, Star International Academy in Dearborn Heights and in Canton at starpsa.org, Universal Academy in Detroit at universalpsa.org, and Universal Learning Academy in Westland at ulapsa.org. Join HES Academies today and enjoy a free Chromebook for every enrolled student.